I want to introduce my good friend Karen Rogers, and she's going to talk about fibromyalgia. She has had fibromyalgia for years, and she wants to talk about her real life experiences that she has with it. So take it away, Karen.
Thank you. So welcome everybody. I'm so glad to see you, and I wanted to just kind of take you through my journey with fibromyalgia in case you're stumbling through your journey, and I'm hopeful if I can help just one person here, then my day will have been made. So first of all, if you have fibromyalgia, I just want to let you know, I called it a journey, but it's really a rocky road. But it's very, very doable, and I'm going to hopefully give you some advice and some tips on how to manage it. And just to let you know, you're not crazy. You are not crazy in the least. For a long time, I thought that something was seriously wrong with me, and find out that this is a true disease state. So just some little side facts. Fibromyalgia affects about 2 to 4% of the population. So, so what I say is, well, how lucky am I to be a part of that 2 to 4%, right? And for those of you that had it, it's a condition that's not really well understood at all. However, if you find the right doctor, like I have, and I'm so grateful for Dr. Stupai, then you know you can be fixed. Is the best way to put it. I know. When I first got fibromyalgia, it was probably about 30 years ago. It was mainly, and I can't stress this enough, it's brought on by stress, and there's other reasons as well. There's usually some sort of a stressor involved, whether it's an emotional or a physical stress, whether it's an injury or an infection that can cause fibromyalgia. But the one thing that I do know is it causes so many different symptoms that you wonder, you know, what is wrong with me? And it's a very, very scary thing because you don't know, between headaches and pain and dry eyes. There's so many variables to this disease state. But the one common thread that I found out for myself personally is that there was a stressor involved. When I was first diagnosed 30 years ago, I had a family situation that I just, you know, in your head, it just lingers in your head, and that's all you think about. That's all you think about. And it physically made me sick, as well as the job that I had at the time. It was a very stressful situation. So, so that's mainly one of the things that you can try to avoid is being stressed. And you know, stress is not good for any disease state, whether it be your heart, whether it be anything. So I would try to say just avoid stress at all costs. What I actually say is that stressors fester. So don't let them fester. See a doctor as soon as you can. The one thing that I would like to say is there's some other intricate things that involve fibromyalgia, and the one thing that I would ask you to ask your doctor about is to be tested for a gene, and it's called MTHFR, and it's a gene that can impact your body. And it actually shows how well your body can metabolate folic acid and folate. And Dr. Stupai, if I could just ask you to explain that a little further.
Let me talk a little bit more about, for those of you who may not know what fibromyalgia is, it's a condition where, stay right there, where the patient manifests with severe pain, headaches, stiffness. They have a non-restored sleep. They never feel like they get completely rested at night. Their sleep is erratic, and you really need sleep to help your muscles heal and have them restore and repair. And when that's not happening, the pain just intensifies. And the problem is, no one knows, or no one really had a sense of belief in this condition for many, many years. And then in the 80s, the ACR, American College of Rheumatology, did come out with criteria for diagnosing fibromyalgia. So in addition to the type of history that you're getting, there are trigger areas, 16 trigger areas that you can palpate on the body that set the patient off. And normally, then they have areas that they call shams. Those are areas that should not set the patient off. And oftentimes they'll say, no, that's not so bad, but if you hit the right, and the areas are back here in the trapezius of the neck. They're suboccipital underneath the occipital skull. There areas right here, in between the thoracic spine, in the two areas at the lower back that we palpate at the trochanteric bursa, in the medial knees, and we count these. And if you have 11 of these trigger points or more, that's pretty conclusive, along with the history of non-restored sleep and it's something that involves both sides of the body and the upper and lower body. That's the other thing, is it's a very diffuse thing. So actually what made me test Karen for the MTHFR DNA mutation was her daughter told her that she was tested Kate. Mm-hmm. And I said, really? And she says, yeah, I have this genetic thing. And I says, Karen, let me check this. And here she was double positive for that genetic deficiency where you cannot metabolize, you cannot methylate the folate to be metabolized properly. And that then affects the musculoskeletal system. And once we identified that, we then prescribed a methylated folate in B12. It's a prescription called Metinex, actually, and we used Metinex for this genetic deficiency, and it's very amazing. Helpful. It was amazing.
A lot of times, by using chemicals too, like I would clean my bathrooms and I would wonder why the next day I would be sick. And, things like that, weather changes really can affect fibromyalgia. I know in the wintertime, when we're going to have a storm, it's like my body is a human barometer. So I can definitely sense those changes. And I think that goes for a lot of things like arthritis as well. But, those are the things that can actually really impact that. And so Dr. Stoop, I talked about getting checked for this MTHFR gene. Now, you also want to make sure that your insurance will cover this testing too.
And many insurances will not. The UPMC is a real stickler for covering that test. Now, there is a place where we can have it sent, and they would charge you, and I think it can get done for like $180 if you really. If the insurance won't do it, but it's anymore because people are asking for this test to be run. It's not a cheap test, and so we're getting resistance from insurances. Now, when you have that genetic disorder, you can also have problems with blood clots.
Exactly.
And you can develop a condition where your homocysteine level goes up in your body because of the improper metabolism. And when the homocysteine level climbs, it affects your coronary arteries. Mm-hmm. And so it's a condition that will promote coronary artery disease further. Mm-hmm. But once you correct the condition with the methylated folate and B12, we've actually seen the homocysteine levels come down, and they approach a normal range.
Mm-hmm.
So, the patients come in, they are desperate. They have this chronic pain. They think, what's wrong with me? Am I going to die? They have this sense of impending doom. And once we explain to them that, yes, you do have this condition, and I do believe you have pain, and our goal is to give, I will tell the patients, my goal is to give you more better days than bad days. Mm-hmm. And that I want you to know that when you flare, you're not doomed, because there are things that we can do, and we can explain why you flared. And stress is a huge overworking, overactivity, an emotional event, a motor vehicle accident.
Had 'em all.
Those are things that can precipitate this at any time in life.
Yeah.
It tends to be more prominent in women than men, but we certainly have our share of men who have fibromyalgia too. And the way we approach treatment is we like to put them on medications that will restore the sleep, so that the patient gets back into a restored sleep. You have sleep waves called alpha waves and delta waves, and the alpha waves are the awake waves. And if they do a study on the sleep waves in a fibromyalgia patient, they can never get into a deep sleep because these alpha waves impinge on the sleep pattern. And so one of the big medicines we used in the beginning was amitriptyline, which was Elavil, and it stops the alpha wave intrusion so that the patients then can sleep. And we have other medicines that we've been using as well. Not all people respond to Elavil or can tolerate it, but we start with low doses and gradually work up. But the goal is to get you that restored sleep pattern and to minimize stress, really, and minimize overactivity. But the other important thing, go ahead and tell them, Karen.
I can't stress this enough. I feel that I still have days, and at first, like Dr. Stupai said, you kind of think, oh, this is a death sentence. I'm having this for the rest of my life. Well, I've had it for 30 some years. So I'm obviously here, I'm living. But I do have days. There were a couple of situations last year, car accident, family member dying that put me into a flare. However, for the most part, I am doing so great, but I do follow a specific regimen. And first of all, sleep is so key. I notice if I don't sleep, I hurt or whatever. But for the most part, exercise, to me, if you don't exercise, and you know what, I don't care if you're walking 5 minutes a day, 20 minutes, I am a walker. You've got to walk it out. If I have a headache or if I'm feeling pain, if I don't walk it out, guess what? I sit and I am just writhing in pain. It's just, you know what, you have to push yourself. That's the key. And if you don't push you, nobody else is going to. So I strongly urge that you do push yourself. Even if you're getting into a pool, to move your body, just to get that blood flowing throughout your body. A couple of other things that I've done too. I am now on the right regimen of medications. Thanks to Dr. Stupai, I do take the Metnex and I take Lyrica and Cymbalta. And a few other things to add to the list. But the good thing is, there are other ways to go around this, and acupuncture is one. I highly recommend acupuncture. It's helped me in combination with this regimen. I know Dr. Stupai also does a Myers cocktail, correct? You're still doing that. That's via an infusion, and that can be very helpful as well. Meditation, I don't care what you're doing, but take time for your mind, and your mind travels throughout your body, and that can be truly helpful. The other thing that I strongly urge is to have humor, because if you don't laugh, you'll cry. And I, it's always nice to know you're not alone. There are so many groups available through the Fibromyalgia Association. You may even know somebody that has the same symptoms as you. By talking about it, it's so helpful, because if you don't talk to somebody about it, it sort of builds up, and that causes even further stress, which even furthers the fibromyalgia. So, but like I said, exercise and sleep for me personally are the key. And if you get the right doctor and you have the right cocktail, as I will call it, this can be a life-changing event for you, and you can enjoy life.
Very good. Thank you, Karen.
So any questions? Any questions from anybody?
How long was it until it was diagnosed with fibromyalgia? How long did you suffer with it before Dr. Stupai diagnosed it with?
It was probably, I would say, a good 20 years. I went through. I saw infectious disease. I thought, I got bit by something. You think everything. I saw so many doctors before I was actually diagnosed. And
probably cardiology, neurology.
Yeah. Every doctor under the sun, and no one could seem to help at the time. And again, this is going back into the 80s and 90s, or I'd say more so into the 90s. There wasn't a lot known about this disease state, so it took.
Even doctors were.
Doctors don't believe in it. There are still many doctors.
Yeah, still don't believe in this diagnosis. They use it as a wastebasket diagnosis when
it is.
You just have chronic pain,
Mm-hmm. Or they think you want, medications for your pain.
Right.
That's why the person to seek is a rheumatologist. That's what I would highly recommend.
The trigger point was the mention of the gene with her daughter, right? Was that?
Boy, well, I was treating her for fibromyalgia.
Okay.
All along with the medication, but when I heard that Kate had this genetic abnormality, and she didn't come out and say what it was, and I said, I think she's talking about the MTHFR DNA mutation. And I thought, well, if it's genetic, if she has it, maybe she has it. And here you can be heterozygous positive, where you just have one of two different alleles, but she was homozygous. She had both of them,
Yeah.
And it was typical of these people who are around chemicals or cleaners, and they're cleaning and they get sick from smelling that, with this type of DNA mutation. But boy, we sure have to fight insurance to get that test covered.
Yeah.
Some insurances are very good about it. Highmark doesn't bother us too much, but PMC. Yeah.
Anybody else?
And I'm not suggesting that everybody has to be tested for that, but there are certain things, especially if they're not responding like you expect them to, that I think I better check you for this. And patients sometimes are so desperate that, I'll pay for that blood test.
Yes.
And we found a lab that can do it.
The thousands of dollars that I spent throughout the years is unbelievable, and because again, I was seeking other places,
The Beamer also helps fibromyalgia.
There you
It's
go.
also another tool for treating it, the electromagnetic approach.
Mm-hmm.
Any other questions?
Oh, good.
Well, thank you, Karen.
Oh, thank
It's always
you.
a pleasure.